All right, our next group of antibacterials is the aminoglycosides. When you look at these, a lot of them are going to end in myosin, gentamicin, streptomycin. Really good at attacking gram-negative bacilli, so the rod shapes that are purple. But only aerobic ones. Any anaerobic organisms, the aminoglycosides aren't going to work on because they need to get into the cell and they have to use oxygen to get into the cell membrane. What they do when they're inside is they bind the bacterial ribosomes. As I said earlier, like you can either attack the cell wall or the ribosomes because they're different from our cells. And they shut off the protein production that way. Gentamicin is rarely used because it comes with a high risk of ototoxicity. Starts with ringing in the ears, but it can become permanent with extended use of gentamicin. Also, don't use aminoglycosides if you're pregnant due to the ototoxicity that could pass on to the fetus. Causes your nausea, vomiting, diarrhea, typical side effects with a lot of our antibacterials. Streptomycin, really good at treating tuberculosis and the plague. Comes in handy, right? Then we get to our tetracyclines. These end in cycline, like doxycycline, tetracycline. Really broad spectrum antibiotics, good against both gram-positives and gram-negatives. They also bind the bacterial ribosome, really commonly used against Rocky Mountain spotted fever, different types of typhus, cholera, chlamydia, and Lyme disease. Again, nausea, vomiting, diarrhea. They can also cause Candida albicans superinfections. So normally Candida albicans, it's a yeast, and it doesn't, like, you can get like yeast infections, fungal infections, right? But typically your own bacteria, your own flora stop Candida albicans from causing really bad infections. But taking tetracyclines can decrease your own beneficial flora, which then can allow albicans to get in and super spread. Not to be used in kids or people who are pregnant because it can get absorbed into the bones and the teeth and cause a yellowing or discoloration. In recent years, too, we've seen an uptick in tetracycline-resistant bacteria, so these haven't been prescribed as often due to that increase in resistance. Something that's noteworthy is don't take it with anything that has calcium. So don't take it with like food or drink that has calcium, or antacids that have calcium in them, because it'll bind and then it won't absorb. Onto our sulfonamides. It's really cool. Back in 1935, discovered that a byproduct of the dye industry actually stopped infections. And so, like, new antibiotic, right? Hit the market, everybody started using it, and then a lot of bacteria became resistant to sulfonamides. Funny how that happens. Still used for like topical burns. The mode of action of your sulfonamides is for bacteria to grow and reproduce, they need folic acid. They need para-aminobenzoic acid to make the folic acid. And so your sulfonamides are competitive agonists against this para-aminobenzoic acid. And so they bind in place of it. And so the enzyme can't make the folic acid, which means your bacteria can't grow and reproduce. This is a bacteriostatic antibacterial, so it stops them from growing and spreading. Again, nausea, vomiting, diarrhea. A potential harmful or worse side effect is crystalluria, especially if you're dehydrated and have acidic urine. The sulfonamides will come out of solution inside the tubes of the kidneys and start forming crystals, which will then damage the cells, and you'll see like bleeding when you urinate and stuff. A sulfonamide that is still pretty commonly used is going to be a combo drug called Bactrim. It's a sulfomethylazole with your trimethoprim. They have a synergistic effect in the folic acid production in your bacteria. So, where your sulfonamide stops the para-aminobenzoic acid, your trimethoprim also stops the production of folic acid, but using a different pathway. And so together, they have this really large increase in the bacteriostatic effects of your sulfonamides. Typically, Bactrim can be used in respiratory and urinary infections. The next group is your macrolide antibiotics. Macrolide is just a large ring structure. We earlier showed those beta-lactam rings. This is a much larger ring. Also inhibits bacterial protein synthesis. These are going to be drugs like erythromycin, azithromycin, clarithromycin, and then this last one is technically a ketolide and not a macrolide, but it works the same, right? These are given pretty commonly also when people are penicillin allergic, and so you'll get your azithromycin or clarithromycin. Erythromycin's not used as much because it has some pretty serious side effects. The other three, you get your typical three, right? Nausea, vomiting, diarrhea. Our next group of antibacterials are going to be our fluoroquinolones, things like floxin, noroxin. Really good at killing gram-negative bacteria. They work by inhibiting a bacterial enzyme called gyrase, or deoxyribonucleic acid gyrase. And what it does is when the bacterial DNA starts to replicate, as it unwinds to pull apart, gyrase helps with the twisting at the far ends to stop it from bunching up on itself. But with your fluoroquinolones, they inhibit that, and so it twists up on itself, and then you can't replicate the DNA, which means you don't get more bacteria. They can't divide. Antacids decrease the absorption of your fluoroquinolones. Side effects tend to be photosensitivity, headache, dizziness, GI issues, rash, and then not recommended for children or if you're pregnant because it can cause cartilage defects and tendons to burst and tendinosis, and that's not great. Then the last page, this is kind of like throw it all in there. So none of these really fit into a distinct group, right? So chloromycetin, broad spectrum, really used for life-threatening infections, specifically typhoid and meningitis. It inhibits bacterial protein synthesis. Side effects, very toxic. That's why they don't use it unless you really have to. It can cause bone marrow depression, including anemia. A lot of the times it's reversible, but with repeated use, long-term use, you can get anemias that are permanent. Not to be used in infants less than 2 weeks old because it can cause gray baby syndrome. Gray baby syndrome is when the baby, well, under 2 months old, they don't have the enzymes to metabolize chloromycetin, and so it builds up in the body. It causes abdominal extension. It causes circulatory collapse. It causes respiratory failure. and dead babies, and nobody likes that. Clindamycin inhibits bacterial protein synthesis too. It's really effective against your gram-positives and anaerobic organisms. Can cause C. diff, so kind of like with the Candida albicans super infections, you take clindamycin, you kill the harmful bacteria, but also the helpful bacteria, and then C. diff, which is normally found in your intestine, rapidly takes over the unoccupied space and can make you really sick, potentially kill you. Flagyl, metronidazole. This is one we'll talk more about when we get to our protist, because they're very good at killing off protozoans. But they also kill off anaerobic bacteria. They can treat acne and, of course, C. diff. So, cool. If you take clindamycin, you might need Flagyl. Side effects: has a metallic taste, can cause GI issues, dizziness, ataxia, numbness, and may cause disulfiram-like reactions with alcohol. If you remember, disulfiram is a drug that you take if you are dependent on alcohol, and if you have even just like a little bit of alcohol, it makes you super sick, like vomiting. Not cool, unless you want to stop drinking alcohol. Vancomycin interferes with cell wall synthesis and is indicated for both MRSA and C. diff. Vancomycin, again, when you have extreme, like you had to go to the hospital for something, you could get vancomycin in an IV. If they give you vancomycin too quick, it can cause red man syndrome. As it comes in, your histamine just gets released and you get lots of flushing, especially in the upper chest, head area. If the bacteria is vancomycin resistant, there are more drugs out there, some newer drugs on the market that can be used instead of vancomycin. And that is it for our antibacterials. In the next group, we will be talking about our antifungals.